A very good morning to everyone. I am Dr. Payal Sharma, professor from the Department of Mental Health Nursing in the Nursing College. Is going to present the topic about the terminology in the psychiatry. In this topic, we can understand about what are the terminology which is used in the psychiatry, and we are going to discuss about some of them, like the terminologies which regarding the mental health, all the disorders, all the terms. So we are going with this topic. So the first terminology is mental health nursing. Mental health, what is mental health? Mental health is a state of well-being in which the individual is able to recognize his or her potential, cope with the normal stresses of the life, work productivity fruitfully, and make a contribution to the society. That means mental health, the mentally healthy person is always recognizing their potential. They can identify their stress. They can have a potential of facing the stress, and they are productive and fruitful, and as they are working hard, so he is knowing that what he is doing and for what purpose he is doing that, and it releases stresses also, and a mentally healthy person always give a contribution to the society. Now the mental illness, what is mental illness is? The mental illness is like considering to be the clinical significant behavior in behavior or psychological syndromes marked by the patient's distress, disability or risk of the suffering, disability or loss of freedom. According to the American Psychiatric Association 2000, that it means that the mental illness is considered to be clinical significant behavior, that is a clinical behavior or psychological syndrome. In this, there a person is showing some psychological syndrome in which the patient is in distress, in the disabilities, and there is a risk of suffering from the disability from his freedom, that he can't do his work, he can't do it work stress free. So these are all the mental, this is the mental illness. Now the mental health nursing. What is mental health nursing? The mental health nursing is a specialized area of nursing practice employing a wide range of explanatory theories of human behavior as its science and purposeful use of self and its art. What does it mean? It is a specialized nursing area, practice area, in which the nurses and the nursing fraternities are going use their wide range of explanation of the theories of the human behavior with the purpose to treat the patient. So this is the mental health nursing. Now the psychiatric nursing. What is psychiatric nursing is? Psychiatric nursing is an interpersonal process that promotes and maintains the patient's behavior that contributes to integrated functioning. The patient may be an individual, family, group, or organization. So what happened in the psychiatric nursing? It is defined as, it is an interpersonal process, that one-to-one process. The person can interact, or the therapist or the counselor or the nurse can directly interact with the patient, which promotes the behavior, maintains the behavior of the particular patient or person for the integrated functioning. That means the functioning they are doing together are integrated functioning, and to promote or to for the family, group, individual, for all those, the psychiatric nursing persons are integratedly working together for helping any individual, any family, any group, or any organization. This is called as the psychiatric nursing. Now psychopathology of mental disorder. In this we can see what is psychopathology. It is a deviation from the normal behavior. The psychopathology is called as the study of the mental illness or mental distress, manifestation of behavior and experiences which may be indicative of mental illness or psychological impairment, such as abnormal and maladaptive behavior or mental activity. So this term says, in this what is psychopathology? It is a deviation from the normal behavior, how the patient is getting deviated from the normal behavior. Okay. Then is the now we will see about what is psychic means. Psychic means mind and social, and pathos means stresses or diseases, logos means study. So that psychopathology is called as the study of the mental disorder or the mind and social related disorders. It refers to the study causes and nature of the diseases of the abnormal behavior and the sign and symptoms. Now, what are the signs? Signs are the observation and the objective findings elicited by the clinician. That means a sign is observed by the person who is skillful to identify the sign is the sign of the psychological problem or any mental issues. Symptoms and the signs are the objective that the person can see that. The symptoms, what are the symptoms? Symptoms are the subjective experience described by the patients, often expressed as the chief complaints such as depression, mood, like what? It is the symptoms felt by the patient only. The person is able to identify himself only, or he can says by himself only how he is feeling, what are the emotions or the internal conflicts, happiness, sadness, what are going inside him. It is called as the symptoms. Then neurosis. What is neurosis? Neurosis is a condition in which what happens, it is characterized by the mild anxiety experience, directly or altered through defense mechanism. It appears to be the symptoms such as obsession, compulsion, phobia and sexual. And what is neurosis? Neurosis is like the person is aware of, fully conscious, oriented, nothing happened to the psychological condition, but there are the subjective symptoms like anxiety, phobias, OCD, any sexual dysphobias. The person is feeling the neurosis, like the person is feeling mainly the stress. The person is feeling stress. It is the internal subjective matter. Then symptoms are the distressing to the individual, recognize unacceptable, align and reality, and it is grossly intact. That means the symptoms in the neurosis, like the patient is having unacceptable reality, he is worried about the reality, and he is having some problems to accept things, he is worrying. The main is the neurosis is about the worrying of the things. Now psychosis. What is psychosis? Psychosis is the loss of reality. In this neurosis, we can say the person is fully oriented, he is aware of reality, and he is having some worry issues only, anxiety, phobia. But in the psychosis, the person is absolutely is in the absence of the reality. The person is not aware of reality testing, and there is a mental impaired functioning also. For example, like the person may have some hallucination, confusion, a memory impaired. In this, all the cognitive process is getting impaired in this psychosis, like he is not able to think logically, he is not able to memorize, he is having some perception issues, he may also have some, all the dysfunctions related to the cognition process comes under the psychosis. A severe impairment in the social and the personal functioning also happened in the psychosis. For example, due to this impaired cognition process and the cognition process, the person is not able to socialize because he is having some hallucination, some fear, some delusions. Due to these problems, the person is not able to trust someone, so he is having some personal and social issues also. The person thoughts, he is not aware of external reality, and he is suffering from the thoughts and all. Then deviation from the, now we will see about the deviation. As we have discussed earlier, what is psychopathology exactly is? It is a deviation from normal behavior. The person is getting deviated. The first is the disturbance of consciousness. The second is the disorder of motor aspect of behavior, disorder of thinking, disorder of affect. So first we will see about affect, disorder of perception, disorder of memory. So these will comes under the deviation. So in this we have seen disorder of disturbance of consciousness, disorder of motor activity, disorder of thinking, disorder of affect, then disorder of perception and disorder of memory. Then first we will see about the disorder of consciousness. In this consciousness we have, what is consciousness? It is a state of awareness. The person is conscious, that means the person is aware of everything, like he is aware of time, person, place, and he is aware from the reality what is exactly happening with him or her. Then is the apperception. Apperception is the perception modify the person's own emotion and thoughts. It is a problem. The person is hyper thinking. The person is having the over perception like apperception. It is a person modified by the person own emotions and thought. So this is called as the apperception. Okay. Then sensorium. What is sensorium is? It is the state of cognitive functioning of the special senses. The person may have feel that he is having some special senses, like he can guess something, he is having the sixth sense. So there is a special, the state of having special sense is called as the sensorium. Now we will see the disturbance of consciousness. The first is the disorientation. What is disorientation? It is the disturbance of the orientation in the time, place and person. The person is not able to orient according to the time. He can't orient, he is not having that orientation where he is, with whom he is, and for what reason he is doing like this. So this is called as the disorientation. Now clouding of consciousness. Clouding of consciousness, this is the disorder. Clouding of consciousness, it's the incomplete clear mindedness with disturbance in the perception and the attitude. The person is having clouding of consciousness, is not fully know what to do, what to not do, what are all the things he or she have to do. That is called as the clouding of consciousness. Then stupor. Stupor is the lack of reaction and to unawareness of the surrounding, like it is type of coma. In this coma and stupor, the stupor is like there is lack of reaction. The person is not going to give any reaction. He is unaware of whatever happened in her or his surrounding. He is unaware of that, even though he is present in that particular surrounding, but he is unaware of that particular environment. That is called as the stupor. And delirium. What is delirium is? It is a restless, confused, disoriented reaction with the fear and the hallucination. That is the delirium. Then coma. What is coma? It is the profound unconsciousness. The coma is like it is a higher and higher form of stupor. In this the person is only having, it is in this coma and everything, the person is having the eye movement and all, but in the coma the person even not having the eye movement also. So then twilight state. Twilight state is disturbed conscious and with the hallucinations. In this what happened, the person is having consciousness problem with the hallucinations. Then dreamlike state. Dreamlike, the person is not aware of reality. He is always been in the his dream and is not at all aware of the surrounding. Then somnolence is the abnormal drowsiness. That means excessive sleeping. Excessive sleeping, like the person is unaware of reality, is always going for the sleep. That is called as the abnormal drowsiness. He is always tired and he is always want to sleep. It's called, that condition is called as the somnolence. Then confusion. What is confusion is? It is the person is having disturbed consciousness in which it reacts to the environment inappropriately. The person is always confused what is exactly seen to him. It is not reacting according to them. The person is not responding and in a appropriate manner, and it is manifested by the disorientation in the time, place, person. That is called as the confusion. Then drowsiness. Drowsiness is the state of impaired awareness associated with the inclination or desire to sleep. That the person is always drowsy and he is always wanted to sleep. Then sundowning. What is sundowning syndrome in the older persons that usually occurs at the night? It is characterized by the drowsiness, confusion, ataxia, falling as a result of being overly sedated with the medications. That is called as the sundowning. That means it is mainly in the older person, happened in the older person. It is usually in the night, and the person may get drowsiness, confusion, and it always wanted to be sedated. Always sedated. Then the next the consciousness problems are the disturbance in the attention and disturbance in the suggestibility. Now we will see about the disturbance or the disorder of the motor activity. So what are all the disorders happened in this motor activity? increased activity, that is hyperactivity. The person is not going to attend something, is very poor in concentration, in the attention and the concentration span is very low. Because of this, the person is getting higher activity and it's called as the hyperactive. Patient is doing the purposeless active, goal-less active. He is not knowing where he is going, where she is going, but he is doing some activity or roaming here and there and without any purpose, is called as the hyperactive. Then decreased activity. Decreased activity is like opposite of the hyperactivity. In the patient's psychomotor activity is getting down and down, and he is sitting in alone without doing any physical exhaustion. He is sitting quietly without any posture changes, and then the psychomotor activity is getting decreased by the day. It is called as the decrease in psychomotor activity. Then stereotype position. What is stereotype position is, the person is remaining in the particular position is called as the stereotype position, that is in which it comes catalepsy. Catalepsy, the patient is not knowing in the particular position, the person remain hour to hour. If somebody is going to wake up or move that person, the person is not able to move himself, but he will be remain in a particular posture. That is called as the catalepsy. The catatonic stupor, like stupor, the person is not able to move himself, that is catatonic stupor. And catatonic rigidity, the person is not able to move. The stereotype movement, we can see stereotype movement mannerism. There is an involuntary movements of the, like blinking of the eyes, shoulder, that the blinking of the eyes, and like hand movements. It is the involuntary repeated movement is called as the mannerism. Then tics. Tics is called as the muscular movement in which there is no control over the muscles and the movements are happening, is called as the tics. Then echopraxia. Echopraxia is the repeated actions which is involuntary done by a particular person. Then automatism. Automatism, where whatever if we says person that something, he will repeat it automatically. It is called as the automatism. Automatism, if he doesn't want to imitate you also, then only he will imitate you. That is called as automatism. Then negativism. Negativism is what? When we say person to do things, he will definitely going to do the opposite of that particular thing. That is called as the negativism. Then now we will see about the disorder of thought. Disorder of thought, we have flight of ideas. The person is not able to stay on a particular idea, and then he will have the different idea in a particular moment. He is getting from one idea and he is jumping from one idea to another idea, is called as the flight of idea. Then loosening of association is what? Loosening of association is in this in the thought process there is no association. One thought is regarding something else, and the second thought is regarding something else. There is no association between that particular thought, is called as the loosening of association. Then we will see about circumstantiality. Circumstantiality is what? It is like the person, if you ask something to the person will not directly answer you, but he will indirectly go rotating you here and then he will come to the point. That is called as the circumstantiality. Then tangiality is the person, if you are asking person something, he will not going to answer, he will give you the answers regarding this and that here and there, but he is not going to come to the point, and he will make you roaming here and there with their talks, but it will never come to the point. That is called as the tangiality. And in the circumtangiality, the person is guiding you like here and there, but he will definitely come to the point that you have asked. Then it is a prolixity. Prolixity is like the state of quality of being unnecessarily or tediously wordy. For example, the person is speaking unnecessarily things. Okay, Then is the perseveration, like a particular thought is getting stuck to the patient's mind. For example, there are many prime ministers keep on changing in every 5 years, but if we ask the patient what who is the prime minister of India, he will, if he knows the answer that Pandit Jawaharlal Nehru was the first prime minister of India, he will say Pandit Jawaharlal Nehru. Either the any prime minister has got changed. Then thought blocking. Thought blocking is what? Thought blocking is there is no new and there is no idea or any thought is getting developed in the patient's mind, is called as the thought blocking. The patient is not having any thought in their mind. Then word salad. Word salad is the mixing of the words, inappropriate words he is using. Then clang association is like then now we will see about the content. Obsession. What is obsession? The repeated thought coming in the mind of a particular person is called as the obsession. He is getting stressed if he is not thinking about that particular thought, that is called as the obsession. He may have some stress. Then compulsion. This is the exactly the thought is converted into the action, is called as the compulsion. Whenever the particular thought is coming in the mind, and if you are doing something about that particular thought, for example washing hand again and again, this is called as the compulsion. The phobias are the particular types of fear which is caused by the particular things like water, fire, dogs. So these are all the phobias. Then suicidal and homicidal ideas. It is like worthlessness ideation of self, hopelessness are ideations. There is a worthlessness idea that we are not of any use. This type of thoughts are coming to the person's mind, and it tends to have suicide. Hypochondriacal symptoms, like the person is not having any physical condition, physical disorder, but it seems the person feels like that he is having some particular problem. Then we will see about antisocial urge and impulses also. In this we will see the person may have the thought of antisocial, of the thought of destroying something or to किसी को परेशान करना, like impulses like aggression and all. So these are all the thought, the person is getting the thought of aggression and all. Then thought insertion, the patient says or thought that somebody has put some thought into his mind, that is called as thought insertion. Then broadcast. In this the patient feels like the whatever happen in his mind and whatever he is thinking is getting broadcasting to the other people, that is called as the thought broadcast. Then thought disturbance, like delusions are the particular false fixed belief. The person is, if it is false also, the person is going to believe it anyhow, it is called as the false fixed belief. The ideas of references and the idea of influence. For example, in this what happened, the idea of references, the persons may think that somebody is going to talk about him. When the two persons are talking togetherly, so he thinks about he's talking about myself only. So this is all about the disorder of thought. Now we will see about the disorder of mood and affect. Pleasurable affect, the things or the pleasurable affect, this gives the patients a happiness moment. Like for example, expensive mood, a patient is feeling unnecessarily very happy. Euphoria is like patient is extra joyful with the elevated psychomotor activity. The person is hyper, patient is feeling very hyper and very happy without any reason. Then elation is like when the patient is having a full of joy with the some increased motor activity, is called as the elation. And ecstasy is like the person is getting away from the surroundings and he is in his own world and he is getting detached from the outer world. Then unpleasurable affect, the moments or the things, feelings which is giving unpleasurable things to the patient, that is dysphoric mood, a painful mood, sadness, anxiety, grief, mournings. Then disorder of person also include imperceptions, hypothesia, anesthesia, paresthesia and hyperthesia. Then illusions are the things. Then what is illusions are It is the false perception, false interpretation of the things in the presence of any stimuli, that is illusion. Then hallucination is what, that is the auditory, visual, olfactory, then sensory also. The person is in auditory, the person feels like he can listening the things, but the another people can't listen it. Then visual, the person can see the things which is not there. Olfactory, the person may smell the things which is not there. Tactile, the person may feel in the skin like there some worms are there. Then gustatory is like taste, if there is no such a taste but he is tasting that particular taste. Then these are all the more hallucinations. Then like hypogonic, hypo hypnopomanic, mood, command hallucination, visceral delusions, reflex hallucination, extra campaign, autoscopy, phantom, mirror image, negative autoscopy, internal autoscopy. Then these are all the all type of perceptions. Now the disorder of memory we can see, like hyperamnesia, the person is more and more a minute to minute things they can memorize, that is hyperamnesia. Amnesia, like it is a loss of memory, but it can be complete, partial and circumscribed. In complete memory loss, the person is not able to think anything. In partial, we have retrograde and anterograde. So what happened in retrograde? Retrograde means the person is forgot about the previous and the past, and anterograde, the person think is having the memory of past, but is unaware of present, that is called as the retrograde anterograde. And circumscribed matlab the person is somehow he is having some memories but he is not having the. Then is the paramnesia. Paramnesia is like deja vu and jamais vu. In deja vu, the person is realizing the memory like this thing is already happened with me, it is already been, I have already been through this event, this type of thinking is happening. And jamais is already the things is happened but he is not able to recognize or recall that particular thing, is called the jamais view. Then is the confabulation. Confabulation is like the person is not going to memorize a thing and he is going to tell you about, he will filling the gap with the miss sentences or the false sentence, that is called as the confabulation. So this is the so this is all so this is all about the topic that we have dealt with, that is the psychopathology. I hope you have understood about all the terminologies. Thank you.